Is mail order orthodontic treatment safe? What is it? How does it work? Let's get into the details. It's a question that I get a lot from patients, and some things that even comes up just when I talk to my friends. So as a friend, let's talk about how it works. There's different models, but in general, somehow the company needs a model of your teeth. In some cases, what that might involve is a kit that they ship to you that you would use to take an impression of your teeth. And then you mail that back. They scan that impression in, and then they have the model of your teeth. Sometimes they partner with dentists where you would go to the dentist, and the dentist would, all they do is they would take a scan of your teeth, and then they electronically transmit that scan to the company, and then they have a model of your teeth. The next step is they take the model of your teeth, and they have an orthodontist or a dentist sit behind a computer and design the tooth movements that are involved, and then the company manufactures aligners, clear trays that are designed to move the teeth. And so those trays are then shipped back to the patient, and the patient starts wearing their aligners. That's pretty much, there's a little bit more to it, but in general, that's how it works. Pretty much the only advantage to that system is that it's a lower cost system than going and having treatment done with an orthodontist. So let's talk about some of the issues. The first issue is right at the beginning, in the diagnostic process, there's not any x-rays involved. So it's really important to move teeth in a way that's safe, and that's a way that's effective, and in a way that's stable. So teeth have roots, and the roots are in bone, and so you want to keep the teeth inside the bone. So if you don't know where the bone is, then you don't know what your boundaries are for where you can move the teeth. The doctor who's looking at the teeth on the computer, all they see is the teeth. There's no x-rays. Another issue is that patient hasn't been examined. So someone hasn't looked at their jaw joint function, hasn't had an interview with the patient to discuss with them about their airway issues or their breathing, their snoring, things like that you might have. There's not really an opportunity to really have the orthodontist discuss different options and different benefits and alternatives to treatment. Usually there's dozens of ways to solve the same problem with orthodontics, and really that's where the orthodontist comes in and uses his or her experience and expertise to present and design the treatment that's going to be most appropriately customized for that patient. So that orthodontist who all they see is the 3D model of the teeth, it doesn't have the whole picture, doesn't have the whole patient. They've never even met the patient. So on the front end, that to me is probably the biggest problem. Then as you're going through treatment, there's not someone to monitor the treatment. You know, as an orthodontist, I use a clear aligner system. I use the Invisalign system in my practice. And even with a clear aligner system like Invisalign that's been around for decades, where there's been millions of patients that have been treated and thousands of patients that have been treated by me, I still struggle. I mean, things don't always work out. And like every appointment, I'm troubleshooting, I'm looking at what's happening, and there's things that I'm having to adjust for that the patient just can't do on their own. So like if you're at home and you have all these trays, something doesn't fit right or something doesn't feel right, who do you talk to? Like my patients, they have a problem, they come to me in the office and I talk them through it. We work out the problem, and then I keep track of their progress. I look at them, I see how the trays fit, and I'm able to make adjustments. Then on the back end, once you're done with the treatment, once you have all the teeth where they need to be, we have to look at stability and retention. So retention is a huge problem in orthodontics, because you can get all the teeth in the right place. Let's assume that a mail order system can get the teeth in the right place. But one thing that I also didn't mention is that it's really hard for a mail order system to correct the bite, because you're not having attachments or elastics or things like that. But let's get back to it. Once you get to the retention phase of the treatment, that also requires customization and monitoring, because once you have made this investment, you want to protect the investment. So going back to what I said was the advantage is cost. Really, it's not a good value, because in the end, most of the results that you're going to get, if any at all, are not stable. And that's been really the experience of many people. You can make minor changes, certainly, but really the best option for patients is to consult with an orthodontist, with someone who has the education and the experience that's required to help the patient have an amazing experience and a great result. So if you want to talk more about treatment with clear aligners or with traditional orthodontic treatment, please give our office a call, and I look forward to seeing you in person.